vasopressor is off.
Sedated initially for the
You just don't have these letters.
Dr. Urchin, actually, the study was only given at the time he was, so he's not on anything at this time. I'm gonna go run this. Okay.
Analyze his gas.
Don't want to talk to them about.
Hey ma'am, as it's mentioned, as you know, this patient was on the floor yesterday, but during last night, it was found that the breathing was pretty difficult, and his blood pressure was pretty low. So they immediately transferred him to the ICU and started the treatment. Gave him a bolus of IV fluid and to hydrate him, and then intubated him for better breathing. He was found to have carbon dioxide too high in his blood. That means that he was not ventilating very well. But now he's on the ventilator. We're going to evaluate if he's doing better. We can consider to remove the tube if he tolerates. Okay? Yeah,
And when will this happen?
Really
When will you be removing the tube?
We're
Just
not,
I'm not sure.
right now, we don't know.
you don't
Right,
know.
We're gonna have to reevaluate him
Oh,
and see. We're not gonna take the tube out
Oh.
before it's safe.
oh,
He's
okay.
gonna have to wake up a little bit. He's gonna have to be off of medicines to raise his blood pressure.
Oh, okay.
So he has to have those things corrected before we
For
can make
oh,
him.
okay.
So I do not anticipate he'll come off the ventilator today.
Oh, okay.
We're going to do some tests to see how well he tolerates without the support of the machine. Okay? If he has the capability of doing the breathing by himself, then we consider to remove the band.
Oh, okay.
Has he been interacting with you? Has he been opening his eyes, looking
He
at
opened
you?
up his eyes.
Or did he notice? Did you feel that he was interacting or noticed you? Because there's always a chance when people, end up in respiratory distress, their oxygen goes down. There's always a chance that they might end up with a brain injury. This is always a risk.
When I went over there to him, he opened up his eyes.
Okay.
I think I said something.
Okay.
And he opened up his eyes real big.
All right. And there's always a chance, we generally, as physicians, we try to tell you the good and also the bad, all right?
And I appreciate that.
Absolutely. So another thing is, if we take this tube out, will he be able to breathe on his own? There is always a chance that we might not be able to extubate him. And always the question comes up if, his disease is so severe, if his condition is so severe, what are his wishes and how long did he want to be on the machine?
Well, what condition does he have?
This respiratory failure that he's having, this lung failure that he's having.
Lung failure?
So
That's the reason he had to be put on the machine to breathe for him last night.
Oh, I noticed yesterday when I was in his room, he had his mouth open real wide, and it looked like he's trying to breathe out of his mouth, but was having a hard time.
So we're going to take a close eye on him and then observe to see if his breathing function is improving or not. Okay?
Oh, okay. So he's not in danger right now or anything.
Anytime you are on a ventilator, you are critically ill.
Oh, God.
Anytime you're on a machine to support your life, you're critically ill.
No.
What exactly does he have? I don't understand exactly how he got so sick so quick.
He suddenly developed problems with his breathing.
And he has infection from his urinary tract, and that causes sepsis.
Because his doctor was just out the house first of last week. They're supposed to set him an appointment to have x-rays done on his hands. It's been swollen for a while.
People get sick, sir, and
It's going to
sometimes
a matter
infection.
of hours.
I kind of know I had my sphincter out years back, and I got sick like that, real sick. So I know you get sick pretty quick.
Thank you very much.
Well, thanks
Thank
for
y'all.
explaining
Thank you.
everything. Thank you.
Appreciate it.
Thank you.